we talk about, the rare disease access issues, we have what we call the trilemma to have access on those diseases. So number one is the demonstration of the evidence, and that's the biggest hurdle worldwide. Number two, it is the equity of access. It is very heterogeneous within comparing countries, but also in the same country, being US one of the most unequity countries in the world. So to bring one example, and then the financial sustainability, because treatments are expensive, so we tend to count this as a very costly burden for a healthcare system. So when we talk about evidence, we need to talk about clinical trials. That's the way we test our medicines, and we test the efficacy and the safety of a new treatment. What happens when we talk about rare diseases? It's very difficult to recruit patients because of their nature of the diseases. They are rare, there are very few patients. There is also a lot of difficulties to find them, to include them in clinical trials too. So clinical trials take a lot of time to be performed. And then we have also the heterogeneity of the patients that is very difficult to be reflected in the clinical trials. As well, because of the nature of the rare diseases, a usual, let's say, a standard clinical trial compares an arm in which we treat one medicine and the other one in which we test a comparator. In majority of this rare disease evidence package, we have only one single arm, which makes difficult for regulators and payers to approve those medicines. The surrogate endpoints. So instead of demonstrating, for instance, survival, which will be a clear endpoint for a trial, sometimes the demonstration is about a biomarker. And sometimes even the biomarker result surrogacy, let's say the relation between this marker and the death of survival, is not yet proof. So with all this, it makes very difficult, not to say that sometimes, the trials are short-term and the payers want long-term demonstrations to really finance a treatment. So with all this, we face a lot of issues to have access to those medicines. So to your questions, how can AI and digital data help us with those challenges? So they can help us with solving some of those challenges. So for instance, simulating patients instead of waiting for them. So instead of looking for patients for a clinical trial, the researchers can create digital twins. Those are models that can predict reactions to a drug in the same way a patient will do. So that, of course, saves a lot of time in the clinical trial, not to say in finding the patients. And then we reduce the number of people needed to perform a clinical trial. Another way also to solve the challenge is testing multiple treatments at once. So usually a clinical trial tests one medicine at a time. So imagine that you could make a smarter clinical trial platform that can test multiple treatments simultaneously even in small populations. And this is especially relevant for rare diseases when every patient counts. Finally, finding the right patient faster. So we talk about the difficulty of finding those patients for clinical trials. AI can review healthcare records and also genetic information, of course, under the ethical concerns and safeguards. But once reviewed, they can identify patients that can qualify for clinical trials and contact them and include them in clinical trials in a much more faster way. That means less time for patients to wait for a treatment, and also that the clinical trials can move faster and in a much more efficient way. Also, solving the issue of the heterogeneity of the patient, because by identifying patients through AI, we can reflect better the real world setting.
Raquel, Türkiye'den epey bir bahsettik ama biraz sana dönmek istiyorum. Deniz Hanım da bahsetti. Dünyada farklı güzel örnekler görüyoruz diye. Biraz bize dünyadan Türkiye için uygulanabilecek güzel örneklerden bir iki tane paylaşabilir misin?
Sure. So the healthcare system for a patient present a lot of, frustrating situations. When you are a patient, you have sometimes to wait long times to be diagnosed, also for a consultation, to be treated, etc. There is confusing paperwork and jargon that clinicians use and healthcare people use with patients. And AI and digital data can facilitate and help us to overcome some of those challenges. So to start with, AI can make care much more personal. Imagine that you are a diabetes patient. So instead of waiting till your next appointment to find that something is wrong with your condition, you can have your health care app that alerts you in anticipation when the sugar test readings are presenting certain patterns. And that can save you a lot of problems and also, cost for the healthcare system. Also, there are hospitals that already are using AI to predict which patients will need additional support. They can reach out before to avoid that problems become worse and to avoid, more complications. The reduction on the waiting list wherever. So there are examples. For instance, one US hospital introduced a voice assistant together in the consultations with physicians. And this voice assistant was writes up all the notes during consultations, okay? Transforming, even the prescriptions and everything. This allows the physician to dedicate more time, less time to type in and more time to look at the patient and to talk with the patient. In another cases, hospitals use AI to predict the needs of additional staff, for instance, during the flu season or wherever, or beds, and that helps decongesting emerging room consultations. The help to doctors to focus on what really matters. There is an radiologist spend a lot of time looking at the scans and trying to diagnose. There is an eye hospital in London that is using a model in artificial intelligence that can spot early signs of vision problems with amazing accuracy. That helps doctors to focus on complex cases and let the regular check-ins to the AI-assisted system. And then patients get faster diagnosis. And a better communication, the use of chatbots for routinary questions like, when is my next appointment? What does this lab test mean? How does it relate with my last lab test, etc. So that facilitates communication, avoids telephonic calls, waiting, nurse time, so it facilitates. And if you are wondering, if this is about technology, let me tell you that this is about people. So we are not talking about technology. We are talking about a cancer patient that can get faster diagnosis, a parent that can avoid very painful hours of waiting in an emergency room consultation, or an elder patient that can get an alert before a health crisis and avoid further problems. So that's what technology can do for people. And artificial intelligence, data, use, etc., is facilitating and making our lives better. It's not a question of technology, it's a question of people.
Çok teşekkürler Raquel.